Good afternoon, Doktora.
Good
Good
afternoon,
afternoon.
Anton and Rachel.
Hi,
Yeah.
Doktora.
Good afternoon to all the people watching on the live stream and most especially watching on the replay. So we have a very special episode today. We're introducing our women's health campaign in partnership with Doktora Lilibeth and Dr. Rani. No? So we'll talk about women's health in the times of COVID today, and then the entire program. No, this will be a year-long program, monthly webinars, and we'll talk about it, different things. So if you have any questions, please feel free to put it in the chat below. My name is Anton Diaz, founder of Our Awesome Planet,
And
and
I'm Rachel Diaz,
yes, and
co-founder.
we're with Doktora Lilibeth Genuino and Doktora Marie Rani Cadiz.
Yes.
All right.
Thank you for having us
Here
here.
talking to and thank you for all right. Let's start with introduction para people would would get to know you guys first on your background and why we're doing this. So we'll start with Dr. Lilibeth.
Yes, I am again Dr. Lilibeth Genuino. I'm with the Sigma Phi Medical Sorority of the UP College of Medicine. I'm an obstetrician and gynecologist.
My OB.
Okay, and Dr. Rainy.
Okay. I'm Rani Cadiz, Dr. Rani Cadiz, also an obstetrician gynecologist. I'm also from Sigma Phi Sorority of the UP College of Medicine. So Dr. Lilibeth and I are in the same group.
All right. So to get this started, let's talk about women's health.
So, Doc, ano bang what happened to the what are the top trends? The trends that women parang about women's health. Sorry.
During this time no ng COVID, ano ba meron bang mga trending issues or what happened during this time?
Actually, precisely why we came up with this health series, there has been a drop in the consultations done by our patients, because of the fear of course, contracting the infection, which is COVID-19, as they go to the clinics, especially if the clinics are based in the hospitals. So that is the top trend, actually. Yes.
It is. They have that concern. And if they do go to the clinics, that would mean a very pressing concern is bothering the patient. So sometimes the problem nowadays is we get them late with whatever concern they have. So that's one dilemma of being in a pandemic.
Yes. So go ahead, Rani.
But teleconsultation is a medium that we could use for patients, and based on recent consultations, the most common complaints or concern that they have is problem with their menstruation. Because of the pandemic, everyone is locked down, so majority are like chef at home. So the weight gain and sedentary lifestyle somehow cramp their menstrual cycle.
Yeah. So thank God for the digital platform that has allowed our patients to get in touch with us, and likewise us get in touch with them. No, like what Rani said, usually they would just run to us, no, run to us. Yeah, when there really is a big problem, no, and the usual problem would be that, at least in my practice, what I would usually get as common complaint would be vaginal bleeding. I know it's lunchtime, but we're talking about vaginal bleeding. Yeah, so vaginal bleeding, and I'm talking about not, the usual menses. It's either heavy menses, too heavy menses, or too long menses, or bleeding in between your menses, no, which is of course not normal. That's, to me, is the most common complaint of my patients. Of course, another maybe trending complaint would be vaginal discharges. Excuse again, the vaginal discharges, alongside with either itchiness or burning sensation in the area, the private area. No, so these are the most common complaints that we have. No, and then later later during the pandemic, later in the year, no, that's when I started getting complaints of masses, no. May nakapang parang, Doktora, may nakapa po akong bukol sa breast ko. O bakit malaki yung tiyan ko? Sabi ko, baka sobra ang kain nyo. Diba? Pero yun na nga, may nakakapa naman silang bukol. So ito yung mga kailangan talagang mag face to face, kahit sinasabi na natatakot sila pumunta sa ospital, kinakailangan na papuntahin sila sa ospital o sa clinic para they could be evaluated properly, di ba? And then of course, these are the patients also who would need to undergo some laboratory tests. So parang one go na lang, we usually would schedule a check-up and the laboratory examinations in the same day para sulit ang punta nila. After which, digital platform, we could just follow up with them, the results, no? And then make the final decision whether we should intervene medically or surgically, or we could just observe, no, based on the results.
With that, Dr. Lilibeth, I just have to mention, if the most common complaint or symptoms that the patient consult with you is vaginal bleeding, sa akin naman, it's amenorrhea or lack of bleeding. So they tend to be pregnant. Parang they have infertility issues for long, and then after the lockdown.
So dumami nga talaga ang pregnancy during this time?
Well, yeah. Well, I think in my practice, I've seen a lot of patients with PCOS or those with problems conceiving before, and then suddenly, biglang, positive pregnancy test na.
Because of course, there's more time at home.
More time at home. Less stress.
Oo.
O, Dok, kami, wala
hinihintay ko nga eh.
Namiss mo na ako?
Okay. Yeah. So, galing and maybe can you talk about the webinars, no? That I know you guys are leading, and you've been doing this for a long time. Kasi nga for women's to really help out with women's health. So can you start talking about it?
Yeah. So our webinar series is called the MUla webinars, no? And we've been doing this since 2019, and we started off with issues or concerns of the aged, no? So it was called the Aging and Longevity webinar. So of course, topics were focused on the usual concerns of the senior population, like dementia, mga pneumonia in the elderly. Of course, you also tackled vaccination in the elderly, no? So that was for the first year. And then for our second year, we tackled the issues for the population, so mga children's health issues yan, no? That was last year. And then on to our third of the series, which is the Women's Health series, which is called the MUla kay Doktora, the Doktora Julita, Ramoso, Jalbuena Memorial Women's Health Forum.
Okay.
Haba, no?
Oh, yeah.
Yes. Sige, Rani.
That is in honor of our known sis. She's also a member of the Sigma Phi Sorority, and she's a pillar in obstetrics and gynecology. So we will be having different issues, different topics from July 2021 until next year, June 2022. So we have varied interesting concerns of many women. So here presented to the side, we have the topics for July. For the first month, we will be discussing about executive checkup, because I know many are familiar with the term, but then again, they don't really know why there are a lot of tests being done. I mean, what's the purpose for each test?
Yeah.
So that would start our webinar.
Yeah, we decided to start off the webinar, our series with the topic on executive checkup, kasi to remind people na they shouldn't only consult their doctors when they have problems. You know, they should also consult their doctors to see if they're okay, no? So that's the executive checkup, no? So that's how we're starting our webinar. So our webinar series. So this will go on, like Rani said, every Tuesdays, and sometimes every a second Tuesday, sometimes every fourth Tuesday of the month, from 12 to 1. We decided to do it during the that time kasi for those who are working, yun ang break nila, no?
Mm-mm.
While having lunch, they could attend the forum, ano? Yun. So, ang format natin would be a little different, no? So, of course, what we will have are at least two speakers who are experts in the topic, and then we have a third speaker who's a lay reactor. Para, kasi minsan pag webinar or forum, doctors, kahit sabihin mo for the lay, very formal, and then sometimes you forget that, meron mga lay in the audience. So, we are including a lay reactor to remind them na, uy, andito kami, kailangan maintindihan namin to. So, right away, we have a lay reactor to give the reaction or her comments,
their
or
insights,
his comments, their insights on the topic. And of course, after which, that's going to be around 20 to 30 minutes, no, of speaking. We will allot around 20 to 30 minutes also for questions and questions, no, from the audience, which they could type in. Anyway, there'll be instructions before the webinar kung saan sila pwede mag-type ng mga questions and comments nila, no, on the different platforms. We have actually 4 platforms. We're using Zoom, Facebook, YouTube, and also we're using the UP Manila live stream. So para we could reach out to a lot more, doing this.
Okay. Yeah. So when's the next one will be next week, no? July 13th.
Yeah, that will be the first one. Yeah, July 13th.
On a Tuesday. So
easier
for them to recall Tuesdays. Second Tuesdays of the month.
So for the following, if you want to know about the following topics, so ito yung general executive check-up. Yung pangalawa, it's about those who are already, scheduled for surgery. So it's like, it's actually entitled "Ready, Get Set, Go Surgery." So it's
hindi lang to pregnancy, any
surgery. Yes, any surgery. So it's how to prepare oneself for surgery, and then it's going to be from the what do you call this? We're going to have an anesthesiologist and a surgeon as our expert speakers here, to of course to advise the patients on how to prepare themselves and what they do, no, to of course and assure them of a safe surgery, no.
And the good thing with that webinar, after that, the following month, we will be discussing about post-surgery care. So it's like something those who had surgery beforehand would like to look forward to. In continuity lang ng topic.
Yes. At saka it's also about how to take care of a post-op patient, no, at home. Kasi syempre, again, a lot are fearful of just going to the hospital every now and then. Kasi usually after surgery, there really is a series of follow-ups, no? But this is one forum wherein we could actually advise patients on how to take, and also their relatives or, people they have in their home, how they could take care of one who just underwent surgery at home, no?
Okay.
Yeah.
Sa October. Bakit mastering? Bakit mastering ang title?
Mastering menopause. Kasi kahit alam ng mga babae na magbe-menopause na sila at kung anong i-expect, we have to just tell them, ito na nga ito. No?
The basics.
Let's face the truth. Face the music. Ito na to. No?
Even though it's a very common topic, it's still different when it is discussed in a more, come-on manner. Mastering talaga. Not in the textbook type, but more of a laid-back discussion on menopause.
Yeah.
Okay.
Yes, Rani.
Then in October, we will have topic about cervical cancer.
Okay.
So that would be the start of cervical cancer years, if I'm not mistaken. So what women should know
ba yung nag-increase yung cervical cancer cases o hindi naman?
It's always been high. So it's actually the second most common type cancer in women, and most common cause of cancer-related mortality in the Philippines. So which is why Yeah, which is why if you notice, as Rani mentioned, we're going to have a series on cervical cancer and HPV. So this is about this forum is actually about advanced cervical cancer. Parang
Mm.
hindi naman panakot, but just to tell them na ito ang pwedeng mangyayari if you don't diagnose it early. So the following, if you would notice, the following fora would be focused on HPV. So
Oo.
it's for the HPV series gone viral. HPV viral. HPV
Gone
gone
viral.
viral series. So it will start off with one in November, entitled "The Silent Epidemic," and
And then
then
followed by
It's really an epidemic ang status ng HPV.
it,
um,
it
it's
it's very common. HPV
getting
infection
there.
is very common,
Yeah,
yeah.
yeah,
Worldwide, not just in the
Worldwide.
Philippines.
Okay.
getting there because of the sexual practices these days. No, so that's why you're saying HPV gone viral. So the next,
Mm.
so yeah, Rani, the next one will be
That would be
entitled.
the reason for the HPV infection being viral. So HPV gone viral. Why? Very simple. So why? So and then followed by HPV gone viral, part of the series. Um,
Achieving
Achieving
quiescence.
quiescence in adolescence because it
Ano
has to
ibig
be
sabihin nun?
Ayun na nga kasi
discussed.
dumadami ang mga
Pag-iingat
casos.
ng edad.
Oh, especially among the young ones, no? Because again of the sexual practices these days, no.
Mhm.
So we want to achieve quiescence in that
As
particular
early as
age group.
possible.
Yes,
Yeah.
as early as possible. Just it's about of course, doctor the doctors will talk more about it, but it's about what they should do to prevent
Yeah, prevention.
contracting
Mm.
it, and also if they are into it already, then how to go about having themselves examined, no, regularly, no, for early
Mm.
diagnosis, no. Mm-mm.
Okay.
It's rather a taboo topic for
Ah,
adolescents po kasi. But then again,
ah,
it's something that has to be discussed for
yeah,
Mm.
awareness.
Yeah.
yes,
Awareness.
Oh, galing ah. And then, bakit yung last is male connection? So, ito for male naman ba to?
So
yes.
HPV can be contracted even by male. So that's a misconception
Mm,
because the majority of the people think when we talk about HPV infection that only involves female patients. But
yeah.
it can be
Kala mo
it can be contracted by anyone. So no prejudice, regardless of the age of the sex. Yeah,
That's true, and they could actually be
the socioeconomic status. Yeah,
that's right. They could be the carriers of this. Of course, they are the carry. They could be the carriers of this infection.
likely.
So yeah. So we have actually a urologist and an ENT specialist to talk about this kasi doon usually ang areas na
Affected.
naapektuhan sa males, no? So we're talking about, yeah. So there.
Okay. And then, this goes on until the next year, no?
Yeah, until June 2022. So they have something to look forward to every month.
Okay. And so what do they need to do? They just need to register. Can you share with us
Uh,
anong
they could they could visit our Facebook page, so facebook.com webinars, and then there's a registration link. It's actually free for all. They could also do Zoom registration. So there's also a link there. So
Mhm.
tinyurl.com/ob webinars. But we could only accommodate the first 500 registrants.
For
If
the Zoom, yeah.
yeah, for the room, for the Zoom room. But if they want to see it without registering, they could stream it live at FB Live at New Webinars. They
Yeah.
could also see it via YouTube and the live stream
Yes. Actually,
in UK Manila.
right. The registration actually is for them to be in, so they could be informed through email of the next
reminder.
the schedule, the schedules for the next, the succeeding webinars, no. And second, it's also if they are interested in getting a certificate of attendance, no. This is anyone could get a certificate of attendance. However, for the medical professionals and allied medical professionals, they could actually avail of CPD units. This is a requirement
Ah,
for renewal of our
Renewal of
PRC,
ID.
oo.
PRC
May
IDs,
PRC
no?
kami pero hindi kami medical.
Oo.
Certificate of attendance na lang. So registration is for that, the certificate of attendance, and then for the medical and allied medical professionals for the CPD units. Otherwise, anyone could join through the different platforms. Oo. Baka kasi some of them will get turned up, ay, kailangan palang mag-register. Hindi naman kailangan na kailangan. Only if they need a certificate of attendance and or CPD units. Yun. Oo.
All right. Galing ah. So maybe last question. The Mu Sigma sorority.
Yeah.
Maybe can you describe explain it lang?
Oo. So the Mu Sigma Phi Medical Sorority started in 1934, so that makes us 87 years strong. No?
Wow.
Thriving on our ideals of sisterhood, women power. No? So we're thriving on our ideals of sisterhood, scholarship, leadership, and service. Of course, service. No? So we've been doing a lot of projects, usually service oriented. No, so this is just one of them. It's this new webinar program is actually under the HEAL advocacy of the sorority, which and HEAL stands for Health Education and Literacy. So under the HEAL program, we have other projects like immunity. Wherein, of course, immunity would be more about vaccination, the importance of vaccination. No? So we've been also holding several webinars on immunization, especially when COVID started. And not only especially, but we've been doing this for 12 years now. No? And then when COVID started and the COVID vaccine came about, so we are still continuously doing webinars on this. And we also have the new Health Caravan. No? This is a caravan before the pandemic, again, since 12 years ago. We've been moving from one area, one community to the other, one province to the other, on Visayas and Mindanao, doing pre-COVID, yeah. So we do like actually a day or 2 days of public health lectures in the morning, and then in the afternoon we do some activities like either immunization or we do screening tests like pap smears, no? And so that's what we have been doing for 12 years now. But when the pandemic started, naging syempre online ng aming we had to use the online platform. So we introduced what we call the Sine Gamutan. We always inject the word mu kasi mu, no? So it's actually Sine Gamutan. So ito, public health lectures din to. So ang mga lecturers namin ngayon, mga speakers, meron na silang second job, no, sideline. Script writers na sila for our mga expli videos. So we do explainer videos na. So it's a form of explainer videos which we upload. Actually, of course, we do some advertisements also na we're going to have Sine Gamutan, so a lot of people could see the launch of our explainer videos. So that's what we have been doing naman. So we have the teen, the wise. So wise is for the elderly, no? Teen caravan, of course, for the teenage years, and then we have the child caravan and the wealth caravan for women. It stands for women's empowerment and literacy through health education. Wow. So yan. So alternate yan, yung apat na caravans na yan.
Wow. And we're proud to help you and collaborate with you to promote this women series, webinar series. So maybe just finally, can you invite them to watch and join the webinar series?
Yeah, Rani, go ahead.
Okay. So we'd like to invite everyone to please join our webinar series mula kay Doktora. That would start next week. So every Tuesdays of the month, please tune in from 12 o'clock to 1 p.m. You could view it at Sigma Phi Sorority webinars, MU webinars. You could also watch it through YouTube. You could register. Just visit our Facebook page. So we have the registration link. And we hope you could get yourself updated with the other topics in the succeeding months by, of course, registering. And logging into our Facebook page.
Yeah. So just to reiterate what Rani said, we are inviting you to join us in this series, mula kay Doktora, the Dr. Julita Ramoso Jalbuena Memorial Women's Health Forum. This will run every Tuesdays, second or fourth Tuesdays of the month, starting this month. No, so that's 12 to 1. And you could use, we are using 4 different platforms para there'll be no
way to miss.
excuse for you not to join us. So that's the Zoom platform, the YouTube and FB, and of course, the UP Manila live stream. No? So this is to help you sort out when we should go for a consult, and to learn more about our health issues, no? Women's health issues, no? Okay.
If
Thank
they have
you.
any question or inquiries, they could contact newwebinars2122@gmail.com, or they could just go to our FB page at New Webinars. We even have a Twitter account, so just message us there so that we can assist you. Or if you have any question, please participate in our webinar series.
Yeah.
All right. Thank you so
Thank
much,
you.
Doktora. Thank
Yes,
you.
Thank you
and
so much for
thank
having
you.
us.
Looking
Thank you for
forward.
having us. Thank you for
Yeah.
this opportunity. Thank you very much, Anton and Rachel.
Naka-alarm na. Naka-alarm
Naka-alarm
na.
na.
Good.
Excited.
No.
Excited.
Okay, bye-bye.
Bye-bye.
Thank you.
Thank
Bye.
you. Thank you.